Good afternoon. Thank you for joining us on this absolutely beautiful Saturday here in Erie County. We have 3 new positive cases of COVID-19 in Erie County to report today. One of these individuals is in their 60s, one is in their 20s, and one is a child under the age of 5, our youngest case to date in Erie County. All 3 of these new cases are connected to known positives. This has us at a total of 78 positives and 1,533 negatives. Contact tracing continues at the Erie County Department of Health. I'm pleased to report that we have 53 recovered cases to date out of the 78 cases, so that leaves us with 25 active cases today. This information can be found on the new chart that is located under positive cases on the COVID-19 page at eriecountypa.gov. The state numbers are now over 40,000, 40,049 actually, with 1,537 deaths. This is 1,397 new positive cases in the last 24 hours across the Commonwealth. Crawford County has 19 positives, McKean County has 5 positives, and Warren County remains at 1 positive. Chautauqua County has 29 cases with 3 deaths, and Ashtabula has 103 cases and 8 deaths. Please, everyone, continue to act as if everyone you meet is a positive COVID-19 case. We are all excited about the possibility of reopening businesses in Erie County soon, but it's so important that all of us continue to practice the social distancing, to wear our masks, and to practice good personal hygiene. If the stay-at-home order is lifted, we must continue all of these practices as well. Universal masking is our new way of life, and it will be here for a while. Your mask protects me, my mask protects you. We also know that while we are holding these briefings almost every day to educate and inform the public, and we have excellent media partners helping us to communicate this information to all of the residents of Erie County, there are many people out there who don't watch the news, who don't have social media accounts, who don't read newspapers, and who don't have access to the internet. So I am asking all of you to be our partners as well in getting accurate information into the hands of all of our residents. Please mention to the people that you know and you converse with that they should be wearing masks at all times when they're outside of their house, washing their hands frequently for at least 20 seconds, and keeping their distance from others when they are outside their home, a minimum of 6 feet. I can't stress enough that we are talking about people's lives here. Have you heard all of these terrible stories of those who have experienced the COVID-19 virus? Have you seen the images of hospitals and healthcare workers dealing with the pandemic, the exhaustion, the sheer trauma that they experience every day? Please be our partner. Be a superhero. Some people's lives are at risk here. So wear your mask, wash your hands, and keep your physical distance, because we are all in this together. So our environmental team continues to make field visits to educate and assist businesses with compliance. And I'm so glad today to have joining with me today Karen Tobin, the Environmental Branch Director of the COVID-19 team at the Erie County Department of Health. Karen?
Good afternoon. I'd like to share with you what the health department's environmental staff have been doing over the course of the last few weeks. Even though we've been called the enforcement team, we've really been an educational team. It started with Governor Wolf's first order that classified businesses as life-sustaining or not. Remember, it's the governor and the Department of Community and Economic Development that determined how businesses would be classified. And we've been helping those businesses decide where they fall in that classification. We fielded hundreds of phone calls from residences and businesses. For those that were life-sustaining, we have been helping them with a plan. How can they do social distancing? What cleaning and sanitizing do they need to do? How can the employees be educated? We then went to enforcement. We received 976 complaints from the public. Most were against businesses that they thought should be closed or businesses that may not be operating safely. Our staff called every one of those businesses and talked to them. Most of them were life sustaining, so we worked with them on how to operate safely. A few of them were not life sustaining and were supposed to be closed. So we explained the rationale, got them to close, and then our enforcement teams did take over. Our teams consisted of 2 county detectives and 1 health inspector. We visited 183 locations. Of those, 163 were in compliance with the governor's orders. Most of those were construction sites that were doing weatherizing or stabilizing the property so that it would be safe. Some of them were just essential businesses, and again, we reviewed how they could operate safely. Only 20 locations were in non-compliance. Again, some of those were construction sites that were performing non-essential work, and some of them were businesses just that were classified as life-sustaining, and we ordered them to close. Every business came into compliance at our request, and no legal action had to be taken. Phase 2 occurred this past week with Secretary Levine's order that describes specific actions that all the life-sustaining businesses had to comply with. So again, we went to education. Every business in Erie County needs to have at their fingertips 3 documents: Secretary Levine's order, the guidance document that helps explain her order, and the sheet of frequently asked questions. If businesses have all 3 of those documents, they will be able to be in full compliance with Secretary Levine's order. Those documents are found on the Pennsylvania Department of Health's website, on our Erie County website, and you can call us here at the Health Department at 451-6700, and we'd be happy to email you those documents. Again, for any business that's currently operating, they establish how they must be implementing all the requirements. And for any business that hopes to open as soon as the governor allows that, then these guidance documents are a great way for you to start creating a written plan of how you would like to reopen. This week, we just, instead of going right to enforcement, started educating. We received hundreds of phone calls from businesses. The most common questions were, who needs to take temperatures of employees? Employees' temperatures have to be taken at a business where there has been exposure to an individual who's tested positive for COVID-19. Every other business is highly recommended that they take temperatures of employees with a medical grade thermometer that's a non-contact type thermometer. And once the employees' temperatures are 100.4 degrees or higher, they are not to enter work. Again, temperatures are required at businesses where there's exposure and highly recommended for all other businesses. The second greatest amount of questions came from wearing masks or not to wear masks. So we'd like to repeat that employees and customers are to be wearing masks, and please wear them properly. What we're seeing is a lot of people are wearing the masks underneath their nose, or when they go to speak, they're pulling the mask down over their mouth. And that's not what we want to see. You want to keep the mask over your nose and your mouth the entire time. Please use signs at your businesses, prominent signs that say something simple like no mask, no service, so that the people understand coming in that they have to wear a mask. You can greet customers at the door and inform them of the requirement. If you're a small business, go ahead and provide your customers with a mask. Remember, masks are easy to make, or you can just use a scarf or a bandana. The only people that don't have to wear a face covering are children under the age of 2 and those with a medical condition. For those individuals, please provide other options. Those include offering curbside pickup or delivery, or just walk them over to your customer service desk and help them there. The guidances also include steps for what businesses need to do if an employee does come down with COVID-19. It walks them through the process of what they have to do to clean and sanitize their building. Instead of enforcement this week, what we decided to do is get a better picture of how many people were complying with the mask order. So we sent surveillance teams out into the field. Into each zone of the county, we had inspectors sit and monitor businesses for a period of a half an hour to determine, were people going in and out wearing masks or were they not? We monitored 46 locations and we'll be monitoring more again this week. And I was pleasantly surprised and happy to report to you that of all the places we monitored, 96% of the people going in or out were wearing a mask. Again, 96% of the people were wearing masks. So 1,122 people we saw go in or out with a mask, and only 52 who weren't wearing a mask. So that's great news, because that's what we're going to need to be able to prove to the governor, that we can comply with that rule in order for more businesses to be opening. Phase 3 is starting quickly now with businesses that are going to be allowed to be reopened. This begins with the construction businesses. Yesterday, the new guidance came out from the governor. It's called the Guidance for Businesses in the Construction Industry, that will allow businesses to open on May 1st in the construction industry. Please, everyone who's involved with construction, obtain a copy of that document. It's on the county website. It can be available through the health department, and it's on the Pennsylvania Department of Health website. It includes what every contractor and every job site must have, such as hand washing facilities, social distancing, wearing a mask, limiting the number of workers on a job site, limit the sharing of tools, and every site must have a pandemic safety officer assigned to that location to ensure that all the guidances are being implemented. Again, I would just like to say that all businesses should consult these documents, prepare for opening, call the health department for any guidance or assistance that we can provide. We do not know which businesses the government is going to open. It's up to the governor who he chooses. We learn when you do, when he issues at a press conference a list of what businesses can open. That's when we also find out. So please watch the press conferences, and we'll try to keep you up to date on what the next businesses are that will be allowed to open. Thank you.
Thank you, Karen, and thank you and your team for just the tremendous amount of work that you have done, and done so excellently. As anyone listening to this can understand, there has been a tremendous amount of work being done to educate and to help with compliance with our business community and our citizens in general. So there's a lot more work to do going ahead, and I really appreciate Karen coming on with me today to explain all of this and to answer any questions. I just want to have a reminder that there will be no briefing on Sunday tomorrow, and we will continue back here on Monday at 3 p.m. And now I will turn it over to the media for questions for either myself or for Karen Tobin. And we will start today with the Erie Times News. Do we have anyone with us today from the Erie Times News?
Yeah, Kathy?
Yes,
This is Matt Rink.
Hello, Matt.
How are you?
I'm doing fine.
I wanted to ask you a little bit about the availability of testing. Can you speak to that? Of course, as things start to reopen, there's going to need to be additional testing. Can you talk a little bit about that and what we have on the here in Erie County?
Yes, I think that's a great question. Having read a little bit more from the governor today, there's a number of criteria that are going to have to be in place in order for a county to reopen and go into the yellow phase, and one of that is that there is adequate testing for anyone who would need to be tested. Right now, having talked to our partners at Allegheny Health Network, UPMC, LECOM, and we also know that there's testing sites opening up in a couple other entities, such as the Rite Aid that opened this week, that there's adequate testing availability at this point for anyone who would become symptomatic and would be ordered by their doctor to go and have a test. Now, there is not mass testing, but that's not really happening anywhere in the United States. It really is around a person who is symptomatic, or maybe at a high probability because of some contact they had with a known positive. And then, of course, people in our front line on the healthcare teams, they also sometimes are tested when they don't have symptoms. But right now, it is believed by all that we have adequate testing for what is required in order for us to reopen.
Okay, thank you.
Erie News Now?
Hi, Kathy. This is Jonathan Skinner. Wanted to know, you all mentioned, of course, that the majority of people in the businesses that you all monitored were wearing masks. Have you all received any complaints from businesses or customers about the enforcement of the mask mandate this past week, or has it sort of just been smooth overall? I'm
going to let Karen Tobin answer that, since she's been taking those calls.
Could you repeat that question? It was very fuzzy on my end.
Sure. I was calling. I was wanted to know if you all had received any complaints about the sort of having to wear masks, either from businesses or from customers about it this past week.
We received several hundred calls and complaints, mostly against customers not wearing the masks. So we've been working with all of those businesses, trying to educate them and give them suggestions on ways that they can improve compliance.
Okay, so it's mainly been from businesses, and because customers weren't wearing them, sort of trying to figure out how to sort of encourage them to wear them to the store.
Correct.
Okay, all right, thank you.
I know there was some concern earlier in the week from some business owners because they felt that there was maybe some confrontation occurring when they asked people to wear masks. So I just plead with the people listening, and please tell anyone you know, we need you all to be wearing masks, and any business owner that's asking you to put on a mask is doing that for your own good and the good of everyone else in their store. Talk Erie, are you with us today?
Yes, good afternoon, Kathy. It's Joel Natale. I have a question that came in from a listener regarding your role, even as the governor creates these guidelines this week for a region to go from red to yellow. What do you think your role is to be an advocate for Erie County business? Do you think that you'll be able to provide input either to the Department of Community and Economic Development or directly to the governor as far as the types of businesses? Do you feel that you have an advocacy role to play?
So during this whole process, I have advocated on behalf of certain businesses when I felt things weren't fair, I guess, and equitable. That would be, I think, my biggest role. So when we saw a business who was allowed to open under the life-sustaining rules, we saw some other businesses that basically did the same type of work or were in that same field, and they were not able to. So some were able to get a waiver and some weren't. So I advocated on behalf of the businesses within that category who contacted me. And there's been a number of other things. It's often I get a personal call or my staff gets a call from a specific business and they have concerns. And so then I reach out to the DCED. That's mostly my, the way I reach out to the state when it comes to these business closures or openings. And I will continue to do that for this in this next phase as that goes forward. But in terms of the broad categories of what the state is allowing to open and not open, they are using a lot of different data metrics to determine that, along with a number of other things. And I think that that will mostly be left to the state. But within those categories, I certainly want to see equity amongst all of our businesses here in Erie County. I would not want to see one business allowed to open and another not if they're basically doing the same type of work.
Just a quick follow-up. Another part of the question was that certain businesses are just, a husband or wife or just an owner and their helper. Even if there's a size of employee category that may not be, quote, life-sustaining, do you think that they might be able to get some more leeway in opening up and kind of regaining their livelihood?
So it's important to remember in the yellow phase, it's not just life-sustaining businesses, it's many businesses. And my understanding is, and we're waiting obviously to get a lot more detail from the state, but there is going to be maybe a magic number, and I'm hearing 25, 25 people within a building, and I don't even know yet if it's going to be around square footage consideration within that, because I've talked to some business owners who are concerned if it's limited to 25, yet they have this huge business that they could spread out easily. So those are some of the things that we're going to discuss with the state when we have our call this week and get a better handle on. But as you're saying, and I can understand where that business would say, well, gosh, there's only a few of us in here. We actually live together, maybe even. And so it's very little risk for the people who own the business to open up. And if they limit the number of people coming in and everyone wears a mask, I can see where they would feel that they should be one of those that opens up, and I would agree with them. So again, I think that we have to look and see first what the state's going to say and tell us in terms of what their rules are going to be in terms of who can open and who cannot. But it is not around the life-sustaining businesses anymore once we reach that May 8th date, if we are part of that first phase of opening.
Thank you.
Jet TV?
Yeah, hi Kathy, it's Samir. So I just wanted to follow up with you regarding Twinbrook and their announcement that they've postponed any movement forward towards their facility turning into a recovery center for COVID-19 patients. So do you have thoughts, opinions, reaction to that?
Well, I'm very glad to hear that because I think we were all very concerned about that happening. And I don't have any further information beyond that. But again, glad to hear that at least that's been delayed for now. And none of us, I think, that are in the middle of this COVID pandemic work believe that there's a need in Erie County for that type of facility to open. We have a number of facilities who also already have those beds provided that are not in use currently.
And then since we were talking about businesses or potential businesses that could open up during this yellow phase, will you be looking to other states, I guess, to see how they are adjusting? I think Georgia is one of the first. I think tomorrow, actually, they're going to open up a select couple of businesses. I think hair salons and barbershops are part of that. So will we look to those states and how they're implementing that?
So of course this is going to be done on the statewide level, and it'll be driven by the governor, his administration, and the Department of Community and Economic Development. And I'm assuming that they are looking at a multitude of data to really make those determinations. And I'm not sure how much they are relying on other states. We're all unique, of course, and even within Erie, even within the Commonwealth, we have unique areas. So I'm glad to see that they are using data, and they are using scientists to kind of look at this and determine how we can best open. So that's what I'll be looking for guidance from the state on that. Erie Times News?
Yeah, Kathy, I wanted to ask you about the Rite Aid testing site. How are they sharing information with the county, and are any of the new cases we've seen, were they tested at that site?
I don't have that information. I can try to get it for next week, but I don't really know if we've seen any cases from there. And any testing site that would be functioning would have to put the results of those tests into the NEDS system, N-E-D-S-S. That's that statewide data system. So that's where we pull our cases off of. And some of the facilities like UPMC and Allegheny Health Network and LECOM have been actually sending us the results sometimes before they're even in NEDS or as they're putting them in NEDS. So we've had kind of an advance on that. But I really am not clear if Rite Aid has been doing that or not. But I can try to find out for next week for you.
Okay. And as far as the child under the age of 5, do you have any other information about that case? Are they symptomatic? Are they hospitalized? Anything of that nature? I
do not. This is a new case that came in, and of course we're doing all the work that we do around that. But I do definitely know that that case is tied to other positive cases, which obviously would probably make sense that a small child would have been in the presence of somebody else. They wouldn't have contracted it by just, for the most part, not by a community spread.
Right. Okay. Thank you.
Erie News Now?
Kathy, you mentioned there about community spread. Is there any sort of reason that you feel that we haven't had that kind of community spread, and as sort of other places have, and most of these cases seem to be directly related to cases around them?
So we have done just such a great job because we have a health department on the contact tracing. And we've talked a bit about this, and I know Melissa Lyon talked a little bit about this the other day when she was on, but when the person is diagnosed as positive, it is a fairly lengthy and time intensive and personnel intensive thing that we do in terms of interviewing that person and trying to go back with them 14 days, who all were they around, how long were they around that person, what were the circumstances. And then of course from there, then we have asked and many people, hundreds of people, over 400, to then go into quarantine. So isolation is for the person who actually is the positive case. Quarantine for 14 days is for anyone who has had that direct contact with that positive person. So I think the fact that we were able to get all of those people to quarantine, stay at home, not go out into the community for 14 days, and we have seen great compliance with that from those people who we have told to do that, that I believe has really kept us from having the widespread community-acquired disease that we have seen in many other communities. And it really is a testament to the people who work at the Erie County Department of Health and to the citizens who actually complied, because it really takes both partnership to make that happen.
Thank you.
Erie News, no, I'm sorry, that was Erie News Now, right? Talk Erie?
Yes, the marina question is coming up again, Kathy. Folks can literally put their boat in Conneaut and sail to Presque Bay and fish in our bay, but our own people can't do that. Do you have a gut feeling of that's going to be a priority on the governor's list? I mean, we're not the only marina in the Commonwealth, but it is a high portion of our economic life here in Erie County.
Certainly, probably many more marinas in Erie County than most other places across the Commonwealth. And obviously, as the weather gets better, people are going to want to get out on their boats. And obviously, when you're out on your boat and on the water, it's probably a pretty safe place to be, especially if it's just you and your family on there that you live with. But I'm not sure what the governor is going to do about that going forward. We certainly would like to be able to allow people to do those kind of things safely. Karen Tobin may have some more information, because I know she's had a lot of conversations with the Fish and Boat Commission as well as the DCED around a marina. So Karen, would you like to add anything?
I know that most of our calls have really been people hoping that we'll have the golf courses, the garden centers, and the marinas open soon. But we have not received any guidance from the governor yet on that. I'm hoping that this week we'll hear something specific, but nothing yet.
Thank you, Karen.
Thank you.
Jet TV?
Yeah, I'm not sure if it's my end or the microphone there, but there's staticky noise or static noise. But I did want to talk about WAB Tech a little bit from either your perspective or possibly Karen Tobin. Have you guys been back out to WAB Tech, and have you been visiting those larger corporations that are open?
I'm going to have Karen speak to that from the enforcement environmental team. Karen?
Yes, we've had enforcement teams out there 2 separate times. Each team, there were 4 detectives and 2 inspectors that went through the buildings out there to make sure that they were doing everything possible to protect all of the workers. There are a lot of workers there, but we went through each building looking for how they're educating all of their workers, how they're doing cleaning and sanitizing, all the notifications that they have posted, the equipment that they've purchased, the hand wash stations. And we were actually very impressed with all the actions that they've taken to protect the workers there. In between the 2 visits, we've been in constant contact with the officials of WABTech. Any suggestions that we've given them for improvement, they have immediately implemented there.
Great. Thank you, Karen.
And then will you guys be going back out? Or have you kind of
We haven't decided if we'll need to go back out again. If we need to or get any other further complaints, we will certainly return, but we definitely stay in constant contact with the management there.
And then a really quick follow-up to what you mentioned earlier about the surveillance, just to see the population and the percentage that was actually wearing the face mask. So can you tell us the locations you went to? Were they just like Walmart, those big giant stores, or were they just community areas?
It was a variety. We had the inspectors go to small businesses, large businesses, some restaurants, some grocery stores to get a good feel for all different kinds of businesses, what we were seeing. We found areas such as Zone 2 in Mill Creek Township had over 99% compliance with mask wearing. So that was very impressive. Even the city of Erie, it had around 85% compliance with mask wearing, and that was much higher than I was expecting for the first few days of a new guidance going into place. So we're hoping that over time, with each day, that compliance rate improves even more.
One thing I just want to add to that is one of the things that we have done through the health department and the team that we've pulled together is we're continually trying to get all of our fact sheets and our information available in other languages. And so we have done that, and I think it's going to be really important for some of our businesses who will reopen that are opened by our newer Americans. And so having the ability to have more for all of our citizens to understand the importance of why a mask needs to be worn and why they need to have that social distance. So we're really working, you know, besides having Mark here every day with me speaking and translating in sign language, we are working hard to make sure that those who English is not their first language also can truly understand the importance of this. So just a whole lot of work going on in this area to make sure we reach every single citizen. Erie Times News, do you have any last questions? Matt, are you there with us? I'll come back around to you if you, I'm not sure what's going on there. Erie News Now, do you have any last questions?
Yeah, just looking ahead to that May 8th potential reopening, what do you sort of see as being the new normal? What do you feel like that's going to look like, Kathy? And also, just the last thing, you know, you mentioned the work that's being done here by the community and by the health department. Would you sort of say that you feel like the community overall as a whole is taking the virus seriously at this point, or what's sort of your opinion on that as well?
I think the vast majority of our citizens are taking this very seriously. What concerns me about May 8th, and I have to say I almost put myself in the same bucket, is we're all excited about the lifting of the stay-at-home order and the opportunity, the chance to maybe again connect with our children, our grandchildren, our parents, our good friends, you know, and that all of a sudden we would just get loose about our activity and we would want to hug them. And so we might be able to be around them, but we're still going to have to wear a mask and we still need to keep that 6-foot distance. And that is going to be a whole nother behavioral change that we all have to do, because obviously the first thing we want to do is hug them. But the virus still lives in our community and it will still be here on May 8th. And it's still a very sneaky virus. So we'll be able to maybe be closer to people, but the good thing is it's going to be nice weather, so maybe nicer, hopefully. We can be outside. That would be a better place to be than in a building with somebody. Maybe, you know, having the chance to sit in the yard with someone, but sit 6 feet apart and have a great conversation that's not on a screen. So those are the kind of things I guess I'm cautious about what's happening maybe on May 8th, and I don't want to see a huge spike, obviously, in our caseload after that. We are seeing this spike that we've just been talking about for the last couple of days, and we believe it's really tied to the Easter Passover holidays. And yesterday was one of the worst days in Pennsylvania, the Commonwealth's numbers. The numbers there have been high, and as I was watching the national news last night, it looked like there was a spike in many, many communities, and I think it was all tied back to that holiday weekend. So, gosh, what I wouldn't want to see is, you know, a week or two after May 8th that we would see, again, a huge spike and things get out of control. So we are going to have to continue to live a life that's still very physically distant from those we love and care about. We're going to have to all wear masks. I mean, it is our new fashion accessory, and I can't say that enough. And we're going to have to remember all those other things that we've been doing for 6 weeks or more, washing our hands, cleaning surfaces, etc. So that, I think, is our new normal. But as much as we all want to see the businesses reopen and the stay-at-home order lifted, I think all of us who have been working on this also have a lot of trepidation about what that may result in. Talk Erie, do you have any last questions?
No, thank you, ma'am. I appreciate it.
Sure. Jet TV, do you have any last questions?
Yep, just one more. A viewer reached out and wanted to know specifically why Gabe's was open. So I'm not sure if that would be for you or Karen, whoever would like to answer that.
What is open?
Gabe's?
Gabe's store?
Yes, correct.
I'm not aware of that. Karen, Tobin, do you have any awareness of that?
Remember the Gabe's was an early discussion when the life sustaining business list first came out, and I believe they may have some grocery items in there. There are some types of essentials that they were providing to the community that allowed them to stay open.
Thank you, Karen. Erie Times News, are you with us? Do you have any last questions? Okay, I don't hear Matt out there. All right, with that, I'm going to end. I did want to finish up with one thing I did not mention yet. Yesterday, there was a question about any Erie County employee being positive for COVID-19. We had a few employees who were asked to quarantine because of a connection to a known positive. Unfortunately, when that question was answered yesterday, and by the time I got to the staff, it was late on Friday. So I do not believe we have anyone who has been positive, but I am going to get an absolute clear answer for that to bring forward to the briefing on Monday. So with that, I hope that you all enjoy the rest of this beautiful sunny Saturday, and I hope you have a good Sunday also, and I look forward to being back here with you on Monday. In the meantime, make sure you wear your mask whenever you step outside your home, shopping, walking, whatever you're going outside to do, please wear your mask. Please keep yourself at least 6 feet from anyone you encounter while you are outside of your home. And when you get back home, make sure you wash your hands real good for 20 seconds before you touch anything else and clean your surfaces. And in the meantime, I hope that you stay home and that you stay safe and that you stay calm. Thank you.